Hey guys, it's Ashka Joshi. Welcome back to my YouTube channel. I hope you guys are doing well. So these last few videos we've really focused on how and what we should be educating the public in regards to basic oral health care. And this isn't really specific to any population. The same logic can be applied to children, it can be applied to adults, it can be applied to the elderly, and even individuals with special health care needs and intellectual disabilities. So this video is definitely taking a different approach from those lessons that I implemented through the videos, and it's really going to be talking about and addressing the technicalities of the oral health care disparities that are specifically associated with the children and children that are part of, that live in an underserved population. So early childhood caries and dental caries are referred to as one of the most common chronic conditions worldwide in children. And so this same logic certainly applies to the adult population, because following heart attacks and heart conditions, that's the main leading chronic condition, dental cavities. And so you can see how prevalent it is. Per the American Academy of Pediatric Dentistry, early childhood caries or dental cavities are defined as the presence of one or more cavitated or non-cavitated lesions and missing or filled teeth due to cavities in children 6 years of age and younger. And then in the United States and worldwide, the prevalence of early childhood caries is definitely on the rise and will continue to rise until dental care is made a priority in the people's lifestyles. So the prevalence of dental cavities in children in the United States is about 47%, and it continues to rise for that very reason, for the lack of importance of dental care in certain populations, or the lack of affordability of dental care in those populations. And so, per the American Dental Association, early childhood caries is considered a momentous public health problem that isn't limited to specific populations, but populations all around the world. And so that's saying something. Oral health care does impact a lot of people, and the fact that a lot of people don't get the care that they need, that's also very crucial. And that's also a very big problem. Per the Center for Disease Control and Prevention, 25% of children between the ages of 2 to 5 are indicated to have dental cavities. And so data obtained from the National Health and Nutrition Examination Survey, also known as NHANES, indicated that children significantly below the poverty line bear twice the burden of disease compared to children above the poverty line. So it further indicated that the African American and Hispanic children are at higher risk for developing the dental caries. And it's evident that the burgeoning public health problem of dental caries is not going to instantaneously disappear. And that's not the goal either, right? The implementation of an oral health and dental caries educational interventional program for the underserved and underprivileged children will aid in addressing this problem. So we're not wanting, obviously we'd like for the problem to go away right away, but we all know that's not achievable. And so we have to think about ways that we can implement that. And I think that implementing an oral health education program while trying to find alternative cost-effective means is the best way to approach this public health problem. So a study was conducted in 2005 that analyzed the levels of preventive dental care and the way unmet dental needs in low-income children varied through the analysis of data from the 2002 National Survey of American Families. The survey provided information on over 100,000 non-institutionalized children and adults 65 years and younger. And the data was collected from the adult that contained the most knowledge regarding education and healthcare of the children. So the 2002 survey measured the unmet dental needs and the number of preventive dental care visits. And the primary caregiver was asked the following questions: has the child experienced any delays in receiving care, or have they failed to receive dental care that they require? Or how many times has the child visited the dentist or the dental hygienist for a dental examination, checkup, or cleaning within the past 12 months prior to the survey? The results of the study indicated that more than half of the children without health insurance had no preventive dental care visits. Low-income children that had access to private insurance coverage but with no dental benefits experienced a significant unmet need and were similar to low-income children that did not have insurance at all. Children with parents that had poor mental health were twice as likely to have significant unmet needs compared to other children. So the analysis of the data collected from the 2002 National Survey of American Families indicated that there is that need to expand to the dental benefits to improve oral health among low-income children, even for those that don't have access to insurance, and for those that do have access to insurance but not necessarily good dental benefits. Another study was conducted where a school-based oral health education program was implemented as a clinical trial and was conducted utilizing an experimental learning and or traditional lecturing style in adolescents. So the aim of the study was to determine the effectiveness of experimental learning versus traditional learning in relation to school-based oral health. And so this is referring to the knowledge, attitudes, habits, oral hygiene, gingival health, and caries incidence in Greece, and targeting 13-year-old children specifically. So 87 children were placed in the experimental learning group, and then 80 children were placed in the traditional learning group. Using a questionnaire, the information regarding oral health care, knowledge, attitudes, and behaviors were obtained. The levels of dental plaque were measured using a modified hygiene index, and gingivitis was assessed using a simplified gingival index, and dental caries are measured by recording the number of decay, missing teeth, and filled teeth using the criteria that was provided by the British Association for the Study of Community Dentistry. Among other procedures indicated, the experimental oral health education program was implemented. The teachers utilized the material that was developed and provided by the researchers to teach the children, and then overall the study concluded that the school-based oral health experimental learning in adolescents was more effective than the traditional method in improving than the traditional learning method. And that contributed in an improvement in the oral health attitude and the behavior at the 6-month time period. The study further concluded that the experimental learning improved oral hygiene and gingival health at 6 and 18 months and reduced caries incidence at 18 months post-intervention. So I could continue to go in more depth about other studies that have been conducted in the past, but that's a plethora of literature research that exists out there, and I could go on for hours, and I certainly don't want to bore you guys with all that information. I certainly don't want to give you information overload. So I could continue to go more in depth about the other studies that were conducted. That's a plethora of research, and I certainly would love to share it with you guys, but I don't want to keep you guys here forever and give you guys information overload. I certainly want you guys to take in what I'm saying about the need for oral health care and access to care for this population, as well as the need for educational interventions as an alternative therapy until we are able to find more cost-effective measures for the population to get direct dental care from dental providers. So these studies, the ones that I referenced, emphasize the need for those interventions and more access to care for children. And then additionally, those studies measured and defined the effectiveness of oral health education interventions in the population. Thanks again for watching. I hope you guys enjoyed the video and the information that was emphasized through those studies. And if you guys have any comments or questions, certainly ask below and I will address them. Or if you have any questions or suggestions on other videos that I should do, then I will certainly do those or try to do them as well. Thanks again for watching.